Hi guys, welcome back to my YouTube channel. So today, I'm going to share with you a video regarding dental ergonomics. Be warned though, this video is going to be a long one. But I promise you that this is going to be the best 20 to 30 minutes of your time invested in yourself. You will have improved your quality of life, your work posture, well-being, and also your clinical efficiency. I implore you to watch until the end. But if you short on time, I include the timestamp below. I am a general practitioner and I do a little bit of everything except for advanced surgery and also implant. When I begin my private practice journey, I do not feel the urgency or the need to invest in Loupe because I feel that I can do pretty much everything acceptably well, except for molar endodontics. You see, I did a few molar endos in my undergrads and the experience was horrifying to say the least. I cannot see well. It's going to be very stressful. I'm in constant pain, my neck, my back, and by the end of the day, I am really tired. And I cannot believe living and doing that for the rest of my life. I swore to myself that I am going to invest in microscope. So I scoured the web to find and read more on microscope. I asked my friend, but it seems that the dream of having a microscope is very, very far away because of the prohibitive cost. So I am looking into means if there is any way to DIY my own dental microscope. And along the way, I found out one particular doctor who actually modified a video camera and he used it as a dental microscope. And it blows my mind literally. You see, as I dig deeper, I came across a thread in Dental Town whereby a doctor who had been using Loupe for the past 10 years experiencing pain, severe and chronic pain in the neck. And this is quite surprising because all this while, I have been led to believe that by using Loupe, you will not have such issue. In fact, using Loupe will allow a clinician to work in an ergonomic manner. The doctor went on and was asking if microscope can actually help her. So she is asking and surveying which microscope to look for. So this is quite a new thing for me because all this while I am led to believe that microscope is used specifically for endodontics and not for ergonomic reason. Now, my focus is shifted. Instead of using microscope as a mean to do good endodontics, I am looking at it as a tool to improve ergonomic. As I dive deeper, I came across very relevant and common themes. That is, dentists who are using Loupe for the past 3 to 5 years or even more initially solved their back pain, but then they developed neck and shoulder pain. They did chiro, yoga, exercise, you name it, but their pain was never fully resolved. And now they are asking for help in dental forums. And only once they start to use microscope for majority of their clinical practice, their pain fully resolved. This is a bleak story. Is our profession doomed? I felt at a loss. Is it the only way? Only by using and having microscope that we have any hope to improve our work practice safety and work safely. You see, before I go any further, do look at this picture. Are you working in any of this posture? You see, these are the most common observable posture from my observation. Do photo yourself, video yourself, whatever you do, and then compare it with these main 5 photos. If you are working in such a posture, and if you are having any pain in your back, shoulder, or neck, you shouldn't be surprised. Okay, now I will go and explain about the reality and how human design is designed to work. You see, our spine is balanced on the pelvis bone and the skull is balanced on the spine, whereby in a neutral posture or in a neutral position, the contraction and the flexion muscles supporting our body is in a neutral state. This is not to say that our body is limited to such posture. No, we can very well move in many acrobatic, or we call it unstable or unsafe posture, but only for a short while. This is a total contrast. Where we are working in dentistry, we would be working in unstable and unsafe posture for hours on end, every day, over the years, and such damage and such what we call injury will be compounded throughout the years and causing chronic damage to our musculoskeletal system. Yes, most of you might be still young and you might not have any pain or symptoms of pain for the time being, but that doesn't mean that injury has not occurred. It just means that the injury might not be substantial enough for you to feel or experience any pain. Most of the case, once you have any symptoms of pain, it is usually too late and the damage had been done. As you can see, dentistry in the past, little is known about posture, what is safe and what is not. Now, with more and more evidence coming up and emerging about the widespread of musculoskeletal diseases, we know more about what is what we call as safe and unsafe posture. So here, this is the amalgamation of my research. That is, I coin it as the recipe for ergonomic practice for dentists. Why recipe? Because this is similar to cooking, meaning to say you cannot simply throw in the last ingredient first and the first ingredient last. You must follow the proper sequence, just like in cooking. We have 4 main components that we must sequence it right in the right order. You cannot jump. You must start with the part number 1, and then number 2, number 3, and finally number 4. So what is it? Number 1, you must correct your clinical posture. You must have a correct posture first, and next, you must correct your patient posture, your patient positioning. And number 3 is figuring out the dynamism between the two, and finally, to find the right tools when you have already figured out the first 3 main part, in order for you to maintain your working posture and working in a safe manner. I sincerely recommend you to follow the step one by one. If you are surveying for Loupe, I implore you to watch this video in sequence and go through each key and make a change first in the way you work before buying or investing in expensive Loupe. Why? This is to avoid jumping and buying expensive Loupe while your posture is not corrected first, resulting in unsafe specification of the Loupe, which may reduce your pain and discomfort in the short term, but in the actual fact, it may worsen and compound the damage to your muscular system in the long term. So do bear in mind, and I do hope that you can gain some benefit and improve step by step into your practice. Number 1, correct clinician posture. It is proposed only by working in a neutral posture or posture that is safe to our biomechanic. Only then we can work safely and prolong the health of our musculoskeletal system, and thus prolonging our career. So what is neutral posture? Neutral posture is a posture where the spine is balanced on the pelvis bone and the skull is balanced on the spine in a net equilibrium. But the question now, can we maintain such posture for all procedure? No, of course not. But the key is to maximize our working time in a neutral posture to avoid chronic damage to our musculoskeletal system. Well, of course, it may not be fair to many of you if you are using conventional dental chair, or if you are using a chair that is not really suited to your needs and your body and your biomechanic, or if you are not using any magnification, you might not be able to work in a neutral posture. Of course, the simplest form whereby you can actually see a clinician that is working in a neutral posture is when they are working with microscope. So, to be honest, this part may not be applicable to all of you, because it's going to be challenging to actually maintain and work in a neutral posture without having the right tools at your own disposal. Here, I am using Pentax Prism U NF2. These loops allows me to work in almost a similar posture while using dental microscope. Why? Because it uses deflection technology. And this is why it is also called as a mini microscope. So now, how do you position yourself to be as close as possible to the neutral posture? Number one is to sit straight, not leaning forward or backward. Number two is that you must understand the important angles. That is 110 degree, that whereby your feet and leg, and your leg and torso, represented by the blue line, to be at least of angle around 110 degree. Next is your neck posture in a relaxed level when your eye is looking into the horizon. And the final part is to understand that our arm can work in a degree or ranges of degree from 80 to 110 degree. Why? Because our arm can actually work in various range of angle due to the nature of the joint. Yes, this is basically a disclaimer. I'm not saying that you can sit and work in neutral posture all the time, because I myself might deviate from this neutral posture from time to time, but I will always get back and come back to this posture as soon as I can. Okay, here, as you can see from the photo, the two tools that allows me to work in such a beautiful posture is number one, because of the loop, and number two is because I am using a saddle stool. Okay, if you are using conventional loop, for example, whether it be through the lens or flip, you might need, or you are still required to bend slightly around your neck to be able to see. But you must understand that you must not exceed the safe angle of 20 degree, or meaning that your declination angle for the loop must be at least 40 degree. Okay, now a bit a tips lah, you might say that for me, that I can share with you to probably adjust your chair so that you can sit somewhat close to the posture that I recommend. Number one, if you are using a chair that is comfortable to you, make sure that you can adjust the height so that the chair will be slightly increased, but your feet is firm on the ground. Okay, number two is actually to move the backrest forward as much as possible. This is to support your lumbar curvature. And number three is to sit slightly in front of your seat cushion while the backrest support the back. And as a result, you can see comparison side by side. It's almost similar. But using the stool, because the hip area or the sitting area is designed in saddle mode, my pelvis is actually sitting and rather comfortably, and I don't even need the backrest, because when you are seated in a neutral posture and your spine is balanced almost perfectly, so no muscle contraction or tension is occurring, and thus it allows the spine to be balanced on the pelvis, and you will not need any support at the back to be comfortable. I'm sitting with this posture 6 hours, 8 hours, no issue. Now, what do you see? As you can see, my posture is almost as similar as the posture whereby a clinician is working with a dental microscope. And this is why Pentax is also known as a mini microscope, whereby with a good understanding of posture, you can actually work in almost the same manner, the same posture, while working with a microscope, with one advantage, that is, you can actually move around easily, quite easily, because the microscope, the mini microscope, is mounted to your face. Alright, next is to have correct patient posture. Alright, for the most part, basically there are two most common posture, either supine or slightly slanted. So which one do you prefer or do you use in your practice? Well, of course, the answer whether it's right or wrong is quite subjective. But for me, the only patient posture that allows you to maintain your posture while working in a neutral posture is the supine position. Why? Okay, You must understand, traditionally, patient position is much more upright, around 20 to 45 degrees, and clinician having to work from the side of patient or slightly in front of the patient. This is the most common posture in dentistry for clinician. You see, to be able to maintain neutral posture while working, you must position your patient in a supine, or at least as close as supine as possible. Why supine? Okay, you must understand. Number one, this is to allow the occlusal plane of the upper to be perpendicular with the floor, and ideally to have it 10 to 20 degrees backwards, slightly behind the perpendicular line. This is to allow the ease of visibility of the occlusal surface of the upper with indirect vision. With direct vision, you can actually see almost up to 80% of the surfaces of tooth in the oral cavity. With this position, you can actually see the labial surface of the upper and lower. You can actually see the buccal surface of the left and the right posterior by having the patient to tilt the head. And you can actually see, in fact, the palatal surface and the lingual of posterior by just also asking the patient to move their head to the right and left. Final is the lingual lower anterior, whereby you can actually use your mouth mirror to see it with indirect vision, or if you want to see it directly, you can raise the patient angle upwards slightly so that you can actually see it directly. Of course, there are challenges, especially with elderly patient or patient with hypertension, where they might have a feeling of dizziness or vertigo. Why? Because when their head is almost at the same level with their heart, the blood pressure will cause the blood to rush to the head and cause discomfort, dizziness, and feeling of vertigo. Some patients might also feel that as if they are falling backwards. Of course, even young patients might have this issue. So to alleviate this is to position patient in the supine position and raise the position slightly until it is tolerable to the patient. Now, with modern chairs, they have the lower leg part to move separately from the body. This is to allow the leg part to rest lower in relative to the body. As you can see here, patient feet can be seen much more lowered in newer design chair, and thereby reducing discomfort in the aforementioned patients. In my practice, most patients can tolerate this position, and they should tolerate well. Why? Because this is a position almost similar when they are resting and lying in their bed. So, in my experience, some patients, whereby I did long procedures, especially root canal therapy, they even doze off during the procedure while in this position. If, however, patient when lying down in such position, and they have shortness of breath, it is actually an early sign of having heart and lung problem. And ask patient whether they have any heart or lung problem, especially, for example, if they have any pulmonary edema, congestive heart failure. It is vital to refer them for further examination with our medical colleague. The third key is dynamism. You see, the key number 1 and 2 is not meant to be absolute and unchanging. There are instances whereby you need to move and to change. And having the third key, that is dynamism, to allow us to work safely. It is about maintaining our posture and maximizing working in a safe range. Of course, to know more about safe ranges or the biomechanic, you can read more regarding this. Especially you can search about internal biomechanic or the Alexander methods. You see, to maintain ideal posture for checkup, scaling, filling is easy, but the real challenge is extraction, surgery, which is actually at the core of dentistry. So, dynamism here is to allow us to maximize working in safe posture, even for extraction and surgery. Now, let us look into the pillars of dynamism. Number 1, working area. Number 2, tilting patient head. Number 3, indirect vision. And number 4, adjust patient chair accordingly. Have you seen this diagram before? Of course you have. Basically, this is the fundamentals of four-handed dentistry. What is the key take for this part is actually to understand that you must maximize working in 11 to 1 o'clock position. This is why that it is important to have a well-designed operatory room, whereby you need to have sufficient space for you to actually be seated in a 12 o'clock position comfortably without banging into the wall or cabinet behind you. This is important because having a poorly designed room, you will not be able to sit in such a posture. Next is tilting patient head. What you must understand is that you must be comfortable in working with your patient to tilt their head to the right and to the left according to your needs. You must be able to communicate this with your patient. Yes, I understand some of you is holding a mental image of patients who are coming to you to be treated as if they are coming to spa, meaning they will be sitting, resting, and not doing any motion. This is wrong. You must be comfortable. You must be comfortable in moving and asking your patient to move their head to the right, to the left, chin up, chin down, so that you can actually work safely. The key here is to actually move your patient first before you yourself move. Next is indirect vision. To be a good clinician, you cannot run from mastering indirect vision. You see, for me, mouth mirror is the most essential tool in dentistry, in the most underappreciated. You must use it to the fullest extent and not just to use it for cheek retraction. And to better aid you in your visualization, that is to have a high quality mouth mirror with high reflective index. In this case, I'm using Zig mouth mirror. You will not go back to your old rhodium mirror once you use this mirror, trust me. So do yourself a favor, buy Zig mirror, or at least any high quality mirror for that case. Buy it, use it, thank me later. And finally, that you must be comfortable in adjusting your patient accordingly. Most of the time, in my own experience, in my own observation, we as clinicians, we always sacrifice for others. We sacrifice ourselves, our posture, to serve our patient. This is now proven to be wrong. You must protect yourself first. So you must be able, you must be comfortable in changing and adjusting patient accordingly, be it the chair, whether the height or the angulation. Move the chair when needed. You must move the patient first, or you must move the patient chair first before you compromise your posture. In this photo, I'm actually trying to do a very difficult DO, deep caries management for the lower 6. So I need to use direct vision to actually pack the Teflon cord to actually get a good isolation so that I can actually do my deep marginal elevation. So in this case, I elevate the patient angulation chair upwards more than it should. But this allows me to actually work in direct vision, whereby it is much more easier than actually trying to play with your mirror to see in direct vision and try to pack the cord. Now with direct vision, I can actually work much more at ease, and this allows me to actually get a good contact area when I already did the deep marginal elevation, putting the matrix back and getting a very good distal margin for this filling. Initially, I plan to include in this video a short tutorial in putting everything, every lesson that I've shared previously in a video, in this video, so that you can actually put everything together and practice more ergonomically after you watch this video. But it turns out that the video is going to be too long, so instead I am planning to do another video which show and give the basic fundamentals for you to actually practice ergonomically, tips and tricks, so that you can actually watch that video once you understand the concept in this video, and then perhaps include and integrate some of the lesson, tips and tricks to actually improve your practice. So do watch until the end. So if you want to watch the video, I will link the description in the description. I do hope that you have managed to actually integrate the lessons, the recipe that I shared with you to improve your posture and to work safely. And now, do you notice something?
If you had been following the recipe from the beginning, you would notice that you would be sitting quite far away from the patient. And thus, you need to have tools to actually help you to see and visualize better. And this is where magnification comes into play. This is where the question: how can you work while maintaining such posture? Now, let us look into the tools. There are three main parts. Number one, working distance and declination angle. Number two is the main use cases. And three, other features and consideration.
Before we dive in, I would like to remind you that I have provided timestamp below in the description, whereby you can just click and jump to the portion that you want to rewatch or re-listen, because it is important to get every piece of the puzzle correct. Declination angle. Basically, it is the angle of your scope in relation to your eye level when you are looking to the horizon, when in neutral posture. Well, basically, it is summarized by picture like this. Okay. You can actually use this picture as a guide to measure for yourself. The minimum declination angle recommended by the expert is at least 40-degree angle. This is to allow your neck to bend at a safe angle when working with patient. Now, with the current posture, you would be quite far from the patient, and thus you still need to bend your neck to look down. But it must be within the 20-degree angle for the safe neck bending. So, the idea here is to have a loop that will allow you to work and maintain your neck at the safe posture. You see, this is why many TTL loop through the lens loop fail in that aspect. Why? Because the declination angle built into the loop actually prevents you from working at the safe neck angle. When your DTL loop is lacking or not having sufficient declination angle, you will be forced to bend down to look while working. This is the observation that Dr. Aniko shared in many of her posting in Facebook and also in multiple podcasts she is featured in. Well, you see, the main reason for a clinician to have a neck issue after using 5 years or more of consistent use of TTL loop is due to this. This is the biggest unspoken issue when it comes to TTL loop. And in my experience, either the loop sales rep doesn't know about the issue or they would be hiding it from you. Well, of course, I'm not blaming them specifically. It could just mean that understanding about ergonomic and the biomechanic safe posture is not well thought of by this loop company, and thus it is reflected upon their products. What is dangerous though, and the core reason why I'm doing this kind of videos, is actually to give illumination so that more people would understand about their posture and improve it first before actually trying to survey it and buy loop. Because if they get a loop while having a bad posture, the solution that they are hoping for will not be happening. Why? Because it will backfire and the loop will cause more harm than actually helping the clinician. You see, this is the reason why the doctor that I shared in the introduction have such pain. Because when you are using loop, what happens is that you would normally sit much more upright. And what happens is that you will tend to bend down and look more, or you are forced to actually look down because of the poor declination angle by the loop. It means you will be saving your back from pain, but at the expense of your neck. That is why, even though flip loop have a bad reputation of being heavy and is blamed because of having weight or heavy loop, you are experiencing neck pain. But actually that is not the case. The main reason is because of the poor declination angle. So, having a flip loop actually is an advantage, meaning you can actually correct and find the declination angle that is to have the minimum angle to be working safely. This is why I predict deflection technology loop is the future. It started with Pentax Prism U with cooperation with Koya as the pioneer. Now we have so many contenders coming in with other alternatives. Ergo Prism by Lumaden, Hero Loop, and now even Admantech are coming with their own solution. Personally, I am using Pentax Loop. Even with a light source, the whole setup is only around 120 grams. Yes, if you compare it to other more lightweight options, it seems heavy. But you see, it does not even cause any strain to my neck due to the weight. It's actually very comfortable and I do not really feel the weight at all. Yes, I initially have some heaviness on my nasal bridge because I'm not wearing any spectacle. But even though it's considerably heavy in comparison to other loupes out there, I don't actually have any neck strain because I'm actually sitting in a neutral posture. Next is the working distance. Working distance is the distance from your eye to the patient's mouth when you are working in a comfortable position. In my experience, working distance in such a posture will increase according to your height. The higher you are, the higher your working distance needed to be. I myself have my working distance fitted at around 55 cm and I am around 175 cm in height. Thus, working distance could be quite subjective, but the key now is to ensure that the loupe that you buy will be customized for your distance. And this is another big issue with buying loupe. You must get your measurement by the sales rep when you are actually working on your patient and not by holding the model in your arm. And you cannot buy loupe online without having the measurement properly done in your clinic. And again, this is the biggest weakness with TTL loupe and loupe that is highly customized but non-adjustable, meaning that once you get your measurement, you customize it, and when the loupe arrives and if it does not really fit to your needs, you will be in trouble, meaning you will constantly sending it back for measurement again, changing, and it will, in the end, it will not solve your problem. Alright, getting back to working distance. Okay, when you are working at the higher working distance, the absolute magnification will be reduced. Okay, what it means by absolute magnification, I will explain later. But in the simple manner is that each of the loupe usually have their own magnification that is actually designed by the loupe company at a specific distance. For example, 4x loupe that is actually 4x at 420mm. When you are actually working farther away, for example 450mm, the absolute magnification that you get will be less than 4x. Does it make sense? Means when you are actually sitting much more upright and farther away, for example at 500mm, a 4x loupe that is designed at 420mm will actually give around 3.5, 3.8x magnification or even less. So it's quite difficult to actually gauge the absolute magnification that you get. So the key here is to actually get the highest magnification that you need. Okay, on which magnification I will explain on the next part. So in conclusion, as a general rule, the higher the working distance, the lower the absolute magnification that you will get, but the bigger the field of view that you will get. So these three components are actually interrelated. Next is to consider the main use case. So what would be the main reason or use case of your loupe? So basically, I break it down into three main use cases. Number one, that is for general dentistry. Number two is for surgery and orthodontics. Number three, for endodontics and advanced restorative work. So basically, as a general practitioner, if you are doing basic dentistry, checkup, filling, scaling, extraction, you will benefit by having at least 4x magnification and having field of view of at least 40 to 55mm, which equate to at least a quadrant or canine to canine. For surgery and orthodontics, yes, you heard me right. For surgery and orthodontic, well, both can actually benefit from loupe. So here, magnification may not play such an important role, but you actually need something that can give you the biggest, the widest field of view. In my humble experience, anything that is suitable for general dentistry would suit the need. Why? For orthodontic, for example, you would most likely be bonding 3 to 4 teeth at a time, sometimes 6. But when you are checking the height and the position of the bracket, most likely you will check 1 tooth at a time. So here, the magnification is quite subjective and depends on what you feel you need. And for surgery, as I said earlier, as long as the field of view is sufficient, for example, if you are doing wisdom tooth surgery with 55 to 65mm of field of view, I feel that it is quite sufficient. Of course, if you are doing like a very big surgery, you might need to consider your field of view. And remember, the farther you are, the bigger the field of view would be. For endodontics and advanced restorative, I feel that the magnification should at least be around 4.5 X. And the higher the magnification that you get is better. And the ideal magnification will be around 6x to 8x or even more if you can get it. Because 99% of the time, you would be focusing 1 to 3 teeth at most at a time. Even Pascal Manier used a loop whereby he modified his loop to achieve magnification around 11.5x, if I'm not mistaken. So now, from my knowledge, the highest magnification that a loop can give is from Sagitel, whereby they have an option upwards of 10x for a loop. Of course, if you are comparing on other option, you can actually consider some other loop whereby they have the ability to exchange the magnification as you need. If I'm not mistaken, Oroscoptic and Kepler Exam Vision have that. And it's worth checking it out. But of course, bear in mind though, the first component that you must get it right is actually the working distance and the declination angle.
Next, and the final piece, that is other features to look for. Well, basically this is quite optional, but you can use it as an added benefit on top of the loop that you are actually surveying. Number one is weight. Anything below 120 grams should be acceptable. With light attachment, it should not exceed 150 grams. Light system support, whether it is integrated or customized. Most loop have their own light attachment system, meaning you can actually purchase their light attachment, customized or specific to their brand. But the question now is, does it support other light system? One thing to note is that any loop would benefit from a dedicated light system attachment in comparison to using dental chair light. Why? The closer the light to your eye level, the better. Coaxial light improve and eliminate shadow. Trust me, it is a night and day difference. It is a game changer. So to actually get the most benefit from your loop, get together and buy together the light source. I do not want to sound biased, but I totally recommend for you to check out Lumaden, as they have such a wide variety of attachment for so many brands of loop and support quite a number of different frames for each company. So do check them out. Next is lens clarity. For me, I feel any known brand of loop should have acceptable lens clarity. Without a good light source, you will feel that your loop clarity is inferior. Of course, if you are looking for the best clarity, I would recommend you to actually check out Zeiss, because for me, they have the best lens clarity. But of course, in my experience with Pentax loop, with Hoya, actually their lens clarity is quite acceptable. What you must understand is that if you do not use any specialized light attachment, any loop would feel that the light is insufficient. So by having a light attachment system or a dedicated light attachment system, you will have a better illumination and see better. The final point is for those who are wearing specs. Of course, any loop, if you are wearing spec, you may need to have a prescription lens. Some even bypass it altogether and use headgear. And this is where Pentax loop actually shine the brightest, because it's basically allowing you to actually wear your normal daily spectacle and the loop sit on top of it, meaning you don't need to have a specialized prescription lens for your loop. And it's lighter than a headgear, so it's a win-win. Of course, there are many other options that are much lighter than Pentax, but for me, for those of you who are wearing spec, you would benefit from it. Okay, before I conclude, I want to actually revisit back the point regarding light system. To be honest, if you want to really get the benefit of magnification, you need to have sufficient lighting. And to have sufficient lighting, you must have a dedicated light system that is attached to your loop to actually get somewhat coaxial light system. Okay, when you get coaxial light, you will actually get the best illumination, meaning you will not have any shadows. So for me, in my experience, this actually helped significantly in my ergonomic, for both me, myself, and also my assistant. Because when I have a light source that is mounted to my loop, the light will always follow wherever I see, meaning no more there is no more need for actually to tingle around, change the angulation, change the direction of the chair light. And this improve my efficiency, work efficiency, be in basic examination, scaling, root canal. So this light system, you must get it. Okay, on what specification to look for, I feel that I need to have a dedicated video to explain more. The simple rule to actually find a good ergonomic light is to actually to find something that is at the more yellowish spectrum, meaning you might find something that is close to a natural light, which is around 5000 Kelvin. So if you find anything that is around that light source in terms of the temperature, it should be sufficient. Next, regarding discussion whether to get a wired or wireless system. So it's actually depend on your preference. If you feel that you would benefit greatly from not having to worry about wire, then by all means get wireless system. But of course, you must understand that any wireless system would have less in terms of the battery power, because they need to actually have less weight so that it can be easily mounted to the loop, and thus they need to have a lower capacity of battery. So it totally depends on you. If you feel that you need higher illumination when you want to do root canal, get the wired solution, because with wired solution they usually have the biggest battery pack. So with the biggest battery pack, usually you have the option to have the highest illumination possible for that particular light. So that is the advantage there. Now let us go to conclusion and recap. Basically, you must get the sequence right. Number one is to get your posture right by working and understanding what is neutral posture, and you must understand the biomechanic, or what some call as the internal ergonomic. You must understand which joint that you can actually use and pivot, and which part of our body, which joint that we should not stress, and meaning that they are prone to chronic damage. So that is the most important part, to get your posture right, to understand your biomechanic, and to move and work safely. Okay, number two is actually to get your patient posture right, meaning getting your posture right is one thing, but knowing how to position the patient and allowing you to work the patient with the patient. Of course, there are some patients who could not tolerate such a supine position, so you can actually play around and increase slightly the patient chair in terms of the angle, but do not compromise your posture. Next is to actually understand the dynamism and how to actually work and reconcile both. That is to actually know when to actually use working area effectively, and how to actually tilt your patient head so you can gain mastery in terms of the access in each area of the oral cavity. Next is actually to master and working in indirect vision effectively. Mouth mirror is a skill. It is an indispensable tool, so use it to the fullest extent. And you can actually adjust the patient chair accordingly. Do not be so worried in keeping patient in a static position, in supine position. You can actually move the chair up or down, and this will allow you to actually help to work in direct vision, especially when you need to. But it's a skill, meaning you must actually figure it out on your own. Thus, you must be cautious, meaning you must make an effort to actually maintain your posture and to be aware of your body, your biomechanic, and to work and move your joint that can move safely, and avoid stressing the joint that you shouldn't. Avoid bending and looking down more than 20 degrees. Avoid hunching forward. This would actually save you from having neck pain, chronic neck pain, and also injuring your spine. You can actually move at your hip. You can actually lean slightly forward with your hip while you are actually sitting flat. Have your feet rest and firmly stick to the ground, and have your feet at the position that is slightly in front of the knee and not behind your knee or under the chair. The final piece is actually to figure out which loop that can actually help you and benefit you, and in terms of maintaining the posture that you already have. So here I would like to give a very clear message. Do not buy into hype. Do not buy into discount. Buy something that is worthwhile, that you can use for a long time, instead of buying something that you feel is cheap. The key point is here to actually understand your needs and to actually find the loop that is good enough in terms of quality, but that you feel is worth the value. Always get the measurement when you are working with patient in a clinical setting. Do not buy online, or buy when you are actually getting the measurement using a model, or when you are holding something in your hand. No. Measure something when you are actually having a patient on the chair, when you are working with your patient. If you cannot get your patient to actually sit down, lie down while you get the measurement. Ask your staff members. I am sure if you ask them nicely, they would be glad to help you. Okay, alright, so that's all from me. If you have anything, do drop a comment below, and you can actually email me on my email, which I put in the description. If you have any question, I would be glad to reply, answer any question, any concern that you have, but I will be sharing from my experience and my perspective. I am not an expert or a specialist in this field. I am merely sharing from my experience, and I'm sharing because I am passionate to help people solve their issues. And of course, you can actually go to the primary source, find people who are specialized in this manner. Dr. Bethany Balaji have superb resources on this matter, and Dr. Aniko Bal. That's all from me. See you next time.